So basically, you want to know what is the most effective antidepressants to use when you're depressed. As some of you are aware, you have got different antidepressants such as Sertraline, Citalopram, Fluoxetine, Mirtazapine, amitriptyline, and a whole host of other antidepressants. Now you're seeing your doctor and your doctor's asking you, what antidepressant would you like? If you've never used an antidepressant before, how would you know what to choose? And this is where the problem is. What do I use? Do I use Citalopram? Do I use Sertraline? What are the side effects? How long does it take to work? These are all the conundrums running through your mind, and sometimes the doctor you're speaking to is not very helpful. In terms of my own recommendation, and from my experience of dealing with several patients, I would recommend that the most effective antidepressant to use in depression is actually Fluoxetine. This is also known as Prozac, and it was quite popular in the 1970s when you had, the hippie days and everyone's happy and having children all over the place. Well, Prozac. So basically, in terms of Fluoxetine, it has the least side effects. Most side effects people tend to complain about is it makes them more tired, they keep yawning all the time, or they might have funny nightmares. It takes about 2 to 3 weeks to really kick in. Fluoxetine usually started at a 20 milligram dose, and also it is known as the safest antidepressants to use when it comes to overdose. So with some pills like Sertraline, for example, if you were to overdose on Sertraline, there's an increase that it can cause bleeding. If you were to overdose on Fluoxetine, you're not really going to notice that much side effect apart from maybe feeling a bit sleepy or sweaty or clammy, for instance. Also, Fluoxetine is known to be quite safe to use when it comes to breastfeeding. So I would recommend Fluoxetine above any of the other antidepressants. Second on my list would probably be Citalopram. Simply because Citalopram again has less side effects and usually takes about 2 to 3 weeks to work, similar to Fluoxetine. My third on my list would be Sertraline. Sertraline actually takes about a week or 2 to kick in, but the reason why I put Sertraline on my list is because it has too many interactions and too many side effects. Some people report weight gain, and it can cause increased risk of bleeding if you take it with something like ibuprofen, for example. So my list is Fluoxetine, Citalopram, and Sertraline. Mirtazapine is another antidepressant. However, with Mirtazapine, very good for sleep. Mirtazapine is usually given at night time. It works brilliantly for sleep. Works brilliantly for depression as well as anxiety. Also to mention, Fluoxetine is not good for anxiety. So if you've got depression or anxiety, Fluoxetine will not be the antidepressant of choice. It actually would be either Citalopram or Sertraline or Mirtazapine. And going back to Mirtazapine again, the most common reason why a lot of people discontinue the use of Mirtazapine is simply because it causes weight gain by increasing your appetite. I hope you found this video useful. If you like my channel, please subscribe for more videos.